Still writing medical records manually? Imagine reducing the mental load of a full day's patient care. With ScribeNote, the AI-powered veterinary soap creator, you can streamline record-keeping effortlessly as if you had a personal scribe. I recently used ScribeNote during a hectic string of emergency shifts when I managed over 20 cases in 12-hour days. It drastically cut down my medical record completion time, letting me focus more on patient care and less on paperwork. ScribeNote has truly transformed my workflow. Born from a desire to help, ScribeNote now supports veterinary clinics across North America. It is dedicated to improving veterinary wellness and reducing burnout. Try it now at scribenote.com with a free trial of 50 records. For Reviving VetMed listeners, use the link in the show notes for 100 free notes, 50 more than the trial. Book a no-obligation demo call and see how ScribeNote can simplify your day. Hey everyone, welcome to another episode of Reviving VetMed. In today's episode, we're exploring a topic that's near and dear to many in the veterinary profession and incredibly relevant during this time of year. As some of you know, October is ADHD Awareness Month, and with that, I wanted to take some time to explore how ADHD affects veterinary professionals, both in their personal and professional lives. We'll be talking today about what ADHD is, how it manifests in adults, especially for those of us in high-stress, high-demand jobs, and what strategies can help veterinary professionals navigate these challenges. I'll also be sharing insights on how we as a community can create a more inclusive environment that embraces neurodiversity and supports all team members. ADHD isn't something that only affects children. Many adults live with it as well, and it often goes undiagnosed. And in a profession where focus, attention to detail, and time management are critical, those living with ADHD may find themselves feeling overwhelmed, misunderstood, or even burnt out. But it's important to remember that with the right strategies and support, ADHD can also be a source of unique strengths and perspectives. So whether you're a veterinary professional who's been diagnosed with ADHD, suspect you might have it, or just want to learn more about how to support your neurodivergent colleagues, this episode is for you. So with that said, let's go ahead and get into the content.
This is the Reviving VetMed podcast, and I'm your host, Dr. Marie Hollowaychuk. And my mission is to improve the mental health and well-being of veterinary professionals around the world.
Okay, so first I want to start by defining ADHD and broaden our understanding of how it impacts adults, especially those of us in high-pressure careers like veterinary medicine. ADHD, or Attention Deficit Hyperactivity Disorder, is what's considered a neurodevelopment condition. It affects an individual's ability to focus, to control impulses, and to manage their energy levels. So while many people still associate ADHD with hyperactive children, we now understand that ADHD can persist well into adulthood. And actually, for many, it's not recognized until later in life. This is especially true for women and other high-functioning adults who may have developed coping mechanisms to manage their symptoms, and that allowed them to mask their condition for several years. So what does ADHD look like for someone in the veterinary space? Well, think about the traits that are essential for success in our profession: focus, multitasking, organization, attention to detail, the ability to work under pressure. Now imagine that you have a brain that doesn't naturally excel at those things, but you're still expected to perform at a high level day in and day out. You might find yourself forgetting to put details in the medical record, or jumping from one task to another without finishing the first one, or losing track of time during a surgery or procedure, or even a consult. In a busy clinic, this can lead to feelings of frustration, overwhelm, and often burnout. So people with ADHD often describe their minds as being noisy. They can struggle to filter out distractions, whether it's a conversation in the next room, or the sound of a barking dog, or music playing in the background, even their own thoughts jumping from one topic to another. So you can imagine in an environment like a vet hospital with the phones ringing, patients needing care, a long list of tasks to juggle, that the noise can be amplified tenfold. There's also the emotional side of ADHD, which often goes overlooked. people with ADHD are actually more prone to feelings of anxiety and frustration, especially when they're struggling to meet expectations. So what this can look like is experiences of emotional dysregulation, meaning they might overreact to stress or challenges in ways that feel disproportionate. This can actually affect, in turn, how they interact with colleagues or clients, and can sometimes cause interpersonal conflicts or even a sense of isolation if this also impacts their team members. So I think it's important to highlight as well that ADHD isn't just about challenges or deficits, so to speak. People with ADHD often have an incredible ability to think outside the box. They can often solve problems creatively, and they can handle emergencies with a level of spontaneity and energy that can be a true asset in vet med. I think this is why we tend to see a lot of individuals, just anecdotally, with ADHD in the emergency and critical care space. So while these sorts of strengths aren't always recognized, they absolutely deserve to be. Now that we've discussed what ADHD is and how it can present in adults, I want to dive deeper into the specific challenges that it poses for veterinary professionals. There was a survey conducted by the Veterinary Mental Health Initiative back in 2021 that showed that more than 1 in 5 respondents reported experiencing symptoms consistent with ADHD, even though many of them had not received a formal diagnosis. So what this tells us is that there's a significant portion of our profession that might be navigating these challenges, and it sounds like without the support or understanding that they need. So what makes ADHD particularly tricky in the field of vet medicine is the demand for sustained attention and high-stakes decision-making. Think about performing an emergency surgery, right? You have to concentrate, you have to be precise, you have to follow through with everything step by step, even under pressure. So for someone with ADHD, maintaining that level of focus can be exhausting. They may start out strong, but over time, their attention is going to wander, and there is an opportunity to make mistakes or oversights when that happens. Another significant challenge is time management for individuals with ADHD. And this is because ADHD often interferes with a person's ability to accurately gauge just how much time has passed or how long a task is going to take. This is referred to as time blindness, and it can make it difficult to do things like stick to a schedule or manage appointment blocks or meet deadlines. In the veterinary practice setting where every minute counts, you can imagine that this can lead to running behind on appointments or rushing through medical records or feeling like you're constantly playing catch up. And then, of course, there is the impulsivity. Some veterinary professionals with ADHD struggle to pause before reacting, which can be challenging, of course, when dealing with stressed or emotional clients. I've heard from a lot of colleagues with ADHD who say that they have blurted things out that they later regret or acted on impulse without fully thinking things through, both of which can create friction in a very client or team-centered environment. But again, while these challenges are real, they're not insurmountable. The key lies in first and foremost recognizing them and then developing strategies to work with them rather than against them. Because again, this is the brain's unique wiring. This is not something that you can just flip a switch and fix. So I think one of the biggest hurdles for veterinary professionals with ADHD is getting diagnosed in the first place. I have a few friends and colleagues who have been diagnosed with ADHD as an adult, and this has been a game changer for them. It often does go unrecognized, especially in high-functioning individuals who've developed those coping strategies to support ADHD over time. And some of those strategies might be working late into the night to finish tasks that they couldn't concentrate on during the day, or drinking a lot of coffee or energy drinks to stay focused, or setting multiple alarms to stay on track. The challenge, of course, is that when life becomes complicated, especially in a demanding career like vet med, these coping mechanisms are going to start to break down. And of course, that's going to lead to increased stress, anxiety, and burnout. So how do you know if you or a colleague might have ADHD? Well, there are several key indicators to look for. And the first of those is chronic procrastination. So this is more than just putting off tasks every so often. People with ADHD often find themselves stuck in a cycle of delaying important tasks, even though they know it's going to cause them stress later. The next is struggling with time management. I mentioned earlier that people with ADHD often have a hard time gauging how much time they need for a task, that's so-called time blindness. They may also underestimate how long something will take or just lose track of time entirely. The next thing to look out for is hyperfocused. So this might actually sound like the opposite of ADHD. Well, if a person has ADHD, then how can they focus? But it's actually a common symptom. People with ADHD can sometimes become so absorbed in a task, especially something that they enjoy, that they lose track of everything else, completely neglecting other responsibilities. Another thing to watch for is disorganization. So whether it's their desk, their calendar, their patient notes, individuals with ADHD often struggle with keeping things organized, and this disorganization can create added stress, especially when there's something that they need that they can't find. Another thing to look for is restlessness. Many people with ADHD describe feeling an almost constant need to move or fidget. They may have trouble sitting still, even during really important meetings or during patient consults. And then last but not least, a big thing to look out for as an indicator of ADHD is emotional volatility. ADHD can affect emotional regulation, making people more prone to mood swings or those feelings of frustration I mentioned earlier. They might feel that they're on a constant emotional roller coaster, especially during stressful days in the clinic. So if you recognize these signs in yourself or in a colleague, it's probably worth exploring further. Many adults go through life with ADHD thinking they're just bad at managing time or staying focused, when in reality, there's a neurological explanation behind their struggles. So the sooner you can come to a diagnosis, the better. Again, I mentioned that I know individuals in the veterinary space who have had an ADHD diagnosis as an adult and have found it to be life-changing. For many veterinary professionals, it's this intense sense of relief. It's like, oh, I finally understand that the struggles that I've been facing aren't a result of failure. It's just a condition that I can manage with the right support. Okay, so how does a person get diagnosed? Well, typically this involves a detailed assessment by a psychiatrist, a psychologist, or another mental health professional who specializes in ADHD. And what they'll do is to look at your symptoms, your medical history, and how these challenges impact your daily life. And it's really important to find a professional who understands the demands of your veterinary career and how ADHD might show up in that context. Now, once you get diagnosed, the treatment plan can involve medication, therapy, or a combination of both. So we've all heard of stimulant medications like Adderall or Ritalin. These are often prescribed and can be very effective in helping individuals with ADHD to manage their symptoms. These medications improve focus and reduce impulsivity, and they can also help with time management, just really making it easier to get through a busy day at work. Therapy, especially cognitive behavioral therapy or CBT, can also be super helpful. CBT focuses on developing practical strategies to manage ADHD symptoms. Things like breaking down tasks into smaller steps, using reminders, creating structured routines. Therapy can also help with that emotional dysregulation and give tools for managing the stress and frustration that can come up in individuals with ADHD. And of course, I think one of the most powerful benefits of getting a diagnosis is the self-compassion that comes with it. So many people with undiagnosed ADHD go through life feeling like they're flawed or not good enough, or they're failing because they can't keep up with everybody else. But then once they understand that there's a neurological reason behind their struggles, they can start to let go of that self-criticism and focus on what they need to thrive. So what are some of the strategies that can help veterinary professionals and others with ADHD succeed in practice? Well, of course, there's no one-size-fits-all solution, but there are a few different approaches that can make a really big difference. And the first is to have a structured routine. People with ADHD benefit from having a consistent daily routine that helps them to stay on track. So this might involve setting specific times for doing records or having rounds or doing client callbacks or administrative tasks, checking emails, and sticking to those times as closely as possible. Now, obviously, this isn't realistic all the time, but as much as we can stick to those structured routines, it is going to be of benefit. Second, time management tools can be a game changer. I have talked about time management before, and I'll link to some resources in the show notes, but things like using a digital calendar, setting alarms, setting reminders, doing what you can to stay organized and avoid missing important deadlines or appointments. And I've talked about time blocking before. Some people find this really, really useful, where a person sets aside specific chunks of time for each task and works within those blocks. So this can really help to prevent the brain energy that is needed to switch from task to task, and can really allow individuals to focus on the task at hand rather than feeling like they're being pulled in 20 different directions and having to shift tasks or switch tasks all the time. Another strategy is delegation and teamwork. So veterinary professionals with ADHD often benefit from having a really strong support system in place. So for those of you with ADHD, don't be afraid to lean on your team for help, especially for those tasks that you find really challenging. For example, if you struggle with keeping your patient medical records organized, maybe somebody can help you with that. Maybe you can have somebody who does scribing for you, or you can get help setting up a scribe software program, something that will help you with the things that you feel challenged on so that you can focus on the areas that you really excel. And of course, another strategy is to take breaks throughout the day. I think we often underestimate the fact that ADHD brains can get really fatigued, especially when trying to focus on a task for an extended period. So if you can incorporate short, frequent breaks that help you recharge, they're also going to allow you to stay more productive. So maybe that's a quick walk around the practice or a few minutes of deep breathing. These type of breaks are going to make a huge difference in managing ADHD symptoms. And finally, self-compassion is key. So I alluded to this before, but living with ADHD in a demanding field like vet med is not easy, and there's going to be days where you feel really overwhelmed. But remember that ADHD has its strengths. I mentioned creativity, problem solving, adaptability. By focusing on your strengths and seeking out the right support, you absolutely can thrive in this field. And I know a number of veterinary specialists and extraordinarily competent emergency doctors, other veterinarians and nurses and team members with diagnosed ADHD that are tremendously successful in their work. So I know that you can get there as well. So before I finish up with the episode for today, I do want to talk about the role that veterinary teams and leaders can play in creating a more inclusive environment for individuals with ADHD and really any other neurodivergent conditions. And the first of these is awareness. As team members, I think it's really important to educate ourselves about neurodiversity and the challenges that come with conditions like ADHD. By fostering a culture of understanding, we can also have more empathy and offer more support. And at the end of the day, this creates a workplace where everyone feels valued and able to contribute in their own unique way. The next thing that we need to focus on, of course, is communication, right? The fundamental skill of well-being in the veterinary workplace. We know that veterinary teams thrive when there's open, honest communication, especially in the context of every team member's strengths and challenges. If someone with ADHD is struggling to meet certain expectations, it's really important to have a conversation about how the team can support them, whether that's adjusting the workload, offering more structured feedback, or allowing for more flexible scheduling. And then finally, I want to see us create a workplace in vet medicine that embraces diversity in all of its forms. Neurodivergent professionals bring valuable perspectives and strengths to the table. So by creating an environment where they can thrive, we are ultimately improving the quality of care that we provide to both our patients and our clients. So that's it for this episode of Reviving Vet Med. I hope this conversation about ADHD in veterinary professionals has shed some light on the challenges, but also the strengths that come with living with ADHD. Please take a moment to forward this episode to a colleague or coworker who you think would benefit from hearing it. As well, we would appreciate it if you would subscribe to the podcast so that you are sure to get the new episodes as soon as they drop. If you're interested in any of the resources mentioned in today's episode, please check out the show notes. And you can also follow us on social media at Reviving Vet Med for more tips and strategies for well-being in veterinary medicine. If you have questions about today's episode, suggestions for future topics, or inquiries about becoming a sponsor, please email us at podcast@revivingvetmed.com. I'd like to thank Asia and her team at Bear Beat Productions for producing this episode, and I'd like to thank you for listening. I hope you'll tune in next time. In the meantime, take care of yourself. Bye for now.